Hello, everybody. Welcome into Talking Fitchburg on this wet and rainy Wednesday, March 24th, 2021. I'm Jeremy Crosby back today. Glad Andrew helped me out yesterday and, ready to rock and roll. Andrew, how'd you do yesterday? Taking command of the show altogether. Go okay? Did okay. He says he did okay. That's good. Well, we're still here, so that's got something, right? We got a busy show here today, so we won't pick on Andrew too much. We'll set that aside and save for another day. We're going to be talking with Fitchburg EMS today. Jeff Doslick will be stopping and joining us here for the show. Plus, I thought, hey, did you miss out on the ventilator story that we had with Jeff last month? Well, we wanted to make sure to share that with you. So we'll share that in our digest today and then have a new update for you from Jeff in our guest segment. So all Fitchburg all the time today. And hey, I'm excited for that. So maybe a little partial to EMS, a tiny bit. But as we move on here, let's get into the headlines. And plastic and paper bag drop-off going to be happening at the Fitchburg Senior Center. This will be the entire month of April. It'll be at the Senior Center. The barrel will be in the lower level vestibule. And it will be available 24/7. So you bring those your bags over. Plastic and paper bags, and you can also enter to win a reusable bag from Hy-Vee. So make sure you stop on out and help out with recycling your plastic and paper bags while entering for a chance to win a reusable bag. And I'm gonna tell you, that bag's big, so you can get a lot of stuff in there, more than you can get in those plastic and paper bags, just saying. All right, sticking with recycling, want to remind you too that the spring recycling event has been canceled. Unfortunately, the city was not able to get the spring recycling event scheduled. We are, however, planning on a fall event later this year. Did you know that if you shred your own paper at home, you can recycle that shredded paper in your curbside cart by placing it into a clear plastic bag? Well, you can. Yeah, the bag will be removed and hand for recycling once it reaches Pelletieri's material recovery facility. Go to the website, fitchburgwi.gov, for more information on great recycling tips and everything else in between. That recycling guide is really cool if you haven't checked that out yet. Even what you can and can't recycle, that's on the website as well. All recycling headlines. How about that? All right, moving on, we'll turn to getting your feedback on a few different items. First, transit. Transit surveys are available. The city of Fitchburg and Madison Metro have released surveys to understand current mobility needs and plans for the future services. Head to fitchburgwi.gov to take the survey, and you can also check out the Facebook page of the city. They have a link going to this as well. And Fitchburg Police Department also looking for your feedback. They're working on they're updating their department policy, and it says here, as professional policing organization, the Fitchburg Police Department is committed to continuous improvement in alignment with contemporary standards and best practices. In the effort to continue delivering a high level of service to our community, we have determined a thorough review and update of our policies and procedures is a top priority for 2021. A well-devoted policy manual provides a set of expectations and for department members and better informs the community we serve. Process includes policies will be posted on the police department's website for a period of 3 weeks. There will be approximately 5 new policies added each week. Community members are encouraged to review the policies and provide feedback through the provided feedback link. The feedback will be reviewed and considered by the Lexi Poll primary work group. After the 3-week period, a feedback is reviewed, the policy will become finalized and in place for the department. More information will be shared throughout this process to provide relevant updates and timelines. So if you have any feedback pertaining to this process and the presented policies, or if you have just any questions, you can email the policy feedback at fitchburgwi.gov. As far as the first set of policies that are out there, here's a look at those. These were posted March 17th. So looking at the policy manual, you got Chief Executive Officer, that's Chief of Police, Law Enforcement Authority, oath of office, reporting of employee convictions, citations, and criminal investigation, and employee accountability. All of those are out there. When you go on the website, you can click on each one of these, and then you can read through what the policy says there, and then provide your feedback. And we want your feedback. Like I said, transparent process here is important, and it helps makes their policies definitely a lot stronger. So please provide that feedback. And again, there is the link, excuse me, not the link, the email, to send that information if you have any questions. All right, Andrew talked about this yesterday, but I want to throw it back in here. It's Poison Prevention Week, and this is a good example of, you know, making sure that you do protect yourself and others, especially your kids, right? And it says here, in support of Poison Prevention Week, we are asking everyone to be sure your household cleaners and medications are locked up or stored up and away from children's reach. Or your child's reach. Keep medicine, cleaning detergent, and detergent pods in their container in high places where children can't see them. Yeah, getting it out of the children's reach is super important in protecting your kids from getting sick from any type of poison. And if you haven't checked it out, check out the Poison Control website. They have great information. You can call them and ask questions. I've called and asked questions before on medicine dosage. They'll go and walk through with you on exactly what it is, how it's going to be treated, outlook. They're amazing. So you can check in on that. And I would suggest you do that. Excuse me. All right, finally. COVID vaccine. COVID-19 vaccines can help keep you from getting COVID-19, but more importantly, getting the vaccine can also help you from getting seriously ill or even contracting it, right? COVID vaccination is an important tool to help us stop the pandemic and get back to the things we love. Also remember, you have to do these things. Continue to wear a mask, stay 6 feet apart, avoid crowds, and wash your hands frequently. More key things about the COVID-19 vaccine are available out there, but there's a lot of information out there about vaccines that is false or not correct. So definitely checking your sources. CDC should be one of those. And they've got the facts about the vaccine, information, frequently asked questions, the whole gamma, and we'll continue to share those here on Talking Fitchburg as I come across them. So want to keep that open and transparent as well, so you can continue to learn how to protect you and your family and others around you from getting sick. All right, that does it for our headlines. Coming up next, we open up our digest. We're going to talk about Fitchburg EMS's purchase of ventilators. That's next right here on Talking Fitchburg.
You could be spreading the coronavirus without realizing you have it. So follow guidance from authorities where you live and do your part. It's important to limit in-person interaction with anyone outside of your immediate household, but phone and video chat are safe ways to connect. It's also important to limit any social gathering. This advice applies to people of any age, including teens and younger adults. Visit coronavirus.gov for the latest information.
After you joined our family, it was like, I really do feel complete now.
Welcome back into Talking Fitchburg in our digest, and today we're going to take a look back at a story we ran last month with Fitchburg EMS, Jeff Doslik, explaining their new ventilators, how they work, and how it adds just another great tool to Fitchburg EMS's toolbox.
I wanted to stop in today to talk to you a little bit about a ventilator that we were able to purchase with some of the grant money that was released from the federal government, the CARES Act grant money, and ventilators fell within that category. And we were able to purchase some transport ventilators that we think will make a big difference in patient care as we go through cardiac arrests and some of the patients that have some respiratory issues. And so today I just wanted to show you the Z-Vent that we got from Zoll Medical. So these are currently on each of our frontline ambulances, one, the two in Fitchburg and the one here in Verona. We've used it a couple of times already. The vent allows us to provide a consistent number of breaths per minute, tidal volume, so the amount of air that goes into somebody's chest, the percent of oxygen, and where in normal cardiac arrest, we're doing bag valve mask ventilation. Sometimes that can be inconsistent with just driving down the road, lots of other stuff going on in the ambulance. And so the vent will allow us to set all of those parameters for a patient based on their weight, their height, set the vent up, and it breathes for the patient on its own. So just to demonstrate the vent here, so we'll turn the vent on here. So this will be the initial startup. The vent will run through a self-check quick. We have our test lung on here so that at least as it's breathing breathing into some sort of bellows in order for it not to alarm all the time. So on the display here, it will show the tidal volume. That's something that we can adjust based on patient weight and height. We have a chart in the ambulance for that. We also can set the breath rate. So we have it set at 12. You'll see on the vent here, we can adjust that based on the patient's end tidal or pulse oximetry. We can make adjustments there. We can make adjustments to what we call the fraction of inspired air, the FiO2. We breathe as normal humans, we breathe 21%. Somebody that has a low pulse oximetry or is not breathing on their own, we can increase that to give them more oxygen. Most of the time we'll increase it to 40%. And then the other things here are just some displays that will alarm if we have to provide some airway management for somebody by suctioning them, or we have a leak somewhere. We get alarms that happens as well. A piece of equipment, what we call it a circuit, the oxygen tubing or the tubing that provides the air connects to the top. Then we have a couple of sensor tubings that go in here, and that senses the pressure in the patient if we need to suction somebody or if we have a leak somewhere. That's what these are for. And then in the event that we want to apply more oxygen than the 21%, we have a long oxygen tube that can hook right onto here, and that gives them plenty of oxygen. The other part of the circuit here is it does have a filter on the end. So this short piece of tubing right here is where the exhalation of the patients, when the patient exhales, their air comes out of here. Obviously, especially patients that are really sick or that may potentially have COVID-19, we want to filter that air. Obviously, all of this is disposable, one-time use only, and then it's thrown away. The other important part of the vent for us is the ability to provide CPAP and BiPAP for patients that are having respiratory distress. Now, we can provide CPAP now with a mask such as this one, where we just adjust the amount of oxygen going in, gives them the pressure. For those of you that are on CPAP, you know what I'm talking about. The other important thing is that with the ventilator, we can provide BiPAP as well. So where CPAP is a continuous positive airway pressure, lots of oxygen coming in at the same time continuously, BiPAP gives you pressure on inhalation and exhalation. So it's much more comfortable for patients. If you've been taken to the hospital and put on BiPAP, you know that somebody on BiPAP breathes a lot easier if they're having respiratory distress than they are on CPAP. So the ventilator allows us to make that switch as well. And I think that's really important, especially in the time that we are with COVID, where we can put somebody on BiPAP. It's an enclosed system with an enclosed circuit, and they can breathe on their own, and it's a little bit safer for the providers as well. So a mask similar to this one is the mask that we use. We turn the machine on, it runs through the same checks that it does before, and then we just hook it up to here, and it provides that continuous positive airway pressure. So we just demonstrate for a patient here, we've got the test lung on, otherwise it really won't breathe for the patient. But for example, we have somebody, one of our training mannequins that is intubated here. When we're ready to go, we've turned the vent on, our vent circuit. It has a filter on the end of it, so when the patient exhales, you know, we can filter that breath. We would just hook it up to the patient like this. And because the vent is not very compliant with the chest here, it will breathe for the patient. So just make the assumption that if it's, you know, breathing like this, there's air going into the chest. The reason why we looked at ventilators is for a couple of reasons. One, we feel that it obviously provides better patient care. So patients that are in respiratory distress, we're able to do BiPAP and CPAP. Patients that are in cardiac arrest, overdose patients, we're able to provide a better patient care when breathing for them. The other reason is that ventilators fell within that category. If, you know, we know at the onset of the pandemic, there was some concern about the shortage of ventilators in the hospital setting. The crews have all gone through an extensive training on how to use the vent. We've done vent training almost every month. We've had them on for a couple of months. We do vent training almost every month to keep up on their skills. And in fact, we've deployed the vent, I think, 4 times total in the last 30 days. And we know that it's provided better patient care because of, you know, what it does is breathing for the patient, as opposed to, even though we do good patient care, there's lots of little intricacies in running a cardiac arrest where this helps out.
All right. It's a pretty interesting story, and glad that they have another tool to use as part of all of the tools they have to help keep us safe. All right, let's take a quick break. Coming up next, we have a new update for you from Jeff Doslick from Fitchburg EMS. That's next right here on Talking Fitchburg.
Our hearts are made stronger by how we treat others.
Put her there.
The light you share can impact those around you, but so can the darkness.
Later, twerps.
Did Pete saying mean things bother you?
So when you reach out to another person, take a moment to consider how they will feel and let your heart be the key to making a difference. Because of you, someone's entire day, year, or even life can change.
In every heart, there's hope.
It takes all of us to slow the spread of the coronavirus. So follow guidance from authorities where you live and stay home unless absolutely necessary. Use a delivery service for essential items like food and medicine. If you must make essential trips, stay 6 feet apart from other people. Wear a cloth face covering. And wash your hands for at least 20 seconds as often as possible. Visit coronavirus.gov for the latest information.
Welcome back into Talking Fitchburg. Joining me today from Fitchburg EMS, it's your Deputy Chief, Jeff Doslick. Jeff, how you doing?
I'm doing great. Good morning. How are you?
I am doing wonderful and glad to catch up with you. It's been a little while, so
it has been.
Hopefully everything is going good in your world and at the department. We'll talk a few different topics today. But first and foremost, how is the department doing? What have we been seeing as far as COVID-19 and transports?
Yeah, so I think the department's doing well. We're really looking forward to, at some point in life, getting rid of masks and getting back to a normal sort of EMS. I don't know if that will happen in the near future, but overall, I think the staff is doing well. They're, we're still wearing masks in the station. We're still, taking all the necessary precautions, even though we know COVID is kind of, I hesitate to say winding down, but it's getting less and less. So we're still doing the things we're supposed to be doing, and I think the crews are doing well. And it's been a year since we started this whole process, so it's almost like second nature now. If you don't have your mask on, you're like, oh crap, I forgot my mask, and you run back in and put it on. And so as far as call volume with that is concerned, I think just in looking at runs and listening to what's going on, we're still having some of the respiratory issues, but I don't really see a whole lot of COVID related type calls. We're still doing the precautions, so it's not like we're doing anything different with them, but I don't see that those COVID type calls are coming in. I know at some point the 911 center will start to revisit whether they're going to keep screening for COVID on calls or not, but as of right now, that hasn't changed either.
Yeah, it's been quite the year. And as we look back, this time last year, we were talking about supplies. I mean, we obviously were sharing safety, a lot of safety, and trying to wrap our head around what was going on. But supplies, PPE. I think if people didn't know what PPE was, they do now.
Yeah.
Looking back on that and where we are today, how is the PPE situation for your staff?
So that we're doing well with that. The biggest expense that we have now is gloves. The glove manufacturers have raised the price of gloves tremendously. I just saw an email today that they're going to go up again. So it's a necessary piece of equipment that we have or that we need. So that's the biggest thing. We were sending our N95 masks out to be cleaned to a place on the east side or north side of Madison. That operation will cease as of the 31st. So that tells me that we're able to get N95s. There's a good supply of them. Surgical masks, there's an ample supply of those as well. So it'll change the procedure a little bit for our crew, where they can just use one N95 for an entire shift, as long as they don't do any aerolizing procedures such as albuterol or Atrovent, or they intubate somebody or put somebody on the vent. They should be able to use that one N95 mask for the course of the day. If they have to do those other procedures, then they'll switch out and dispose of one and grab another one. And then we've informed the staff that if they're comfortable wearing a surgical mask on calls, that they can put a surgical mask on for the majority of our calls, and just the N95 for the high acuity stuff. So we're trying to make sure we do the right thing and protect our staff and protect our patients, and still kind of keep good track of our supplies. But I think that we've done a really good job at managing that and making sure that our staff has all the necessary equipment, our patients are protected, and we haven't run out. So I think our staff's done a good job, and Chief Anderson's been pretty remarkable in making sure that everything is there.
Yeah, we can't thank all of you for what you do day in and day out and having to deal with this right at the forefront. So thank you for that overall from not just me, but anybody and everybody for what you're doing day in and day out. Turning to now the vaccine, we got some big news coming in this week about people being able to get vaccinated at home. Tell us a little bit about this program.
Sure. So we got word yesterday that with ADRC and Dane County Public Health, that they've got a program now in place to help citizens that are homebound and are not able to get out and get the vaccine. They're able to call a number that's on there at 240-7400. And you can register through the ADRC to get a vaccination, have someone come out and do a vaccination. So I think it's a really good program that allows people that are probably high risk, that can't get out or don't have any mobility, to still be eligible for the vaccine. And if they call that number, they can get what the definitions of eligibility are, the age requirements, and try to set up a time to get one. Just to let you know, that is not something that Fitchburg is able to do. So we won't go out and do the vaccine. It's something that is done through Dane County, Madison Public Health, and ADRC.
Okay. Yeah, we'll keep passing the information out and sharing that with the residents for sure. But from some of the stories I watched from the news, a lot of people that are afraid to go out too. I mean, some are just afraid to go out. This gives that option to help fit the need, if you will,
Right.
to get vaccinated. Final thoughts here on COVID before we change topics, Jeff. We spent some time also last year talking about being, and this is where I'm tying this in, is being afraid to go to the hospital, go to the doctor, get out there. It's not easy to, the vaccine came out fast, and, we definitely understand concerns out there and stuff. But from your perspective, and just reminding folks that I've had to take my son to the ER, and it's amazing the processes that go through, and had some family members in the hospital. Where are we at today? And specifically, making sure to let people know that, again, whatever ails them, they shouldn't hold off on calling 911 and getting checked out.
Yeah, that's a great point. We remind people every day when they say we don't want to go to the hospital, and we really do feel that they need to go, that if you have those signs and symptoms of a stroke or cardiac or chest pain or shortness of breath, or those things that, ultimately can, become very serious, to not hesitate and call the ambulance. Or if you don't call the ambulance, to go into the emergency room. There's certainly that nothing has changed there. The protections that are taken now with the ambulance crew, and once you get to the hospital, are significant in protecting you and the staff and the rest of the patients in the hospital from COVID-19. We will ask you to put a mask on in the back of the ambulance. The hospital will make sure that you keep it on in the ER, and still go through all the tests. Everything is still as if you are coming in with COVID-19. As far as family members are concerned, I know the hospitals are starting to relax some of their patient visits from family members. What we have been, for the most part, to tell families is, we're not going to take you to the hospital in the ambulance. We suggest that you call before you go into the hospital to visit your loved one. If you are a primary caregiver of an older adult, certainly I would come to the hospital and go into the waiting room and just tell them that you're the primary healthcare provider, such as I am with my mom. And again, with pediatric patients, we'll ask a family member to go with a pediatric patient. Or a special needs patient. We want to make sure that they feel safe in the back of the ambulance and when they get to the ER. So, but I think those restrictions are still in place, but don't hesitate to call. I can't stress enough. We've had several cases throughout the year where after questioning the patient's family, like, how long has this been going on? Oh, it's been going on for a week, but he was afraid of COVID, so he didn't call. And now, we're in a really bad situation. So just call, go in, get checked out. If it's nothing, they send you home. And if it's something, then we're glad that you did it.
Yeah, great information, Jeff, and appreciate all your information today. I'm going to beg you to do a special bonus interview for us again later this month. But
Sure.
Until next time, Jeff, thank you for everything you're doing out there. Thank you to your staff, and we'll look forward to checking back in with you real soon.
Sounds good. Thank you very much.
You bet. Jeff Doslick, Fitchburg EMS Deputy Chief. Love checking in with them, and great information there. And we'll get this posted up on the website too. So share it with your friends, and please stay safe out there. Take a quick break. More to come. You're watching Talking Fitchburg.
If you need to do something to feel okay to drive, you're not okay to drive. Don't drive buzzed.
Find good stuff at Goodwill and bring good home.
Welcome back into Talking Fitchburg. Wrapping up the show for the day. I want to thank Jeff Doslick for jumping on and giving us an update. We'll get that new interview posted, and of course you can check back at our ventilator story we ran last month. All that's up on the website. Well, it's up on our Facebook page, our YouTube page, and you can go back and check the full show back on online. We're also posting the full shows, by the way, Talking Fitchburg on YouTube, so you can check out those full shows. Because I know how much you want to learn about the headlines from, 5 months ago. Just saying. And just to know that I talk to Andrew every show and, all of the Jeremy-isms. Just saying. Okay, put up the graphic. Let's get out of here. Have a great day, everybody.